Hi, I'm Dr Lewis Raiman, a sports and exercise medicine consultant. I work in the NHS, private practice, and in elite sport. Working with elite athletes really helps me provide the highest quality of care to all my patients. Today, I want to talk to you about frozen shoulder. This is a common condition that affects a lot of people and causes a lot of symptoms. So what is frozen shoulder? Well, frozen shoulder, sometimes called adhesive capsulitis, is where the capsule, and that's the lining on the outside of the shoulder joints, becomes irritated, becomes thickened, and really leads to a number of symptoms. This can be pain, can be restricted range of motion, and this results in a big impact in your day-to-day activities. So classically, people who develop frozen shoulder, are those who have either had an injury before, so that may be something that's provoked it. So this could be a sports-related injury, could be from a fall or from something like a car accident. But for a lot of individuals, the condition just develops. We don't completely know why. There has been an indication that individuals with diabetes or other metabolic conditions may be at a higher risk or predisposition to developing the condition. And equally, there is an indication that women may be affected more than men. There is a higher preponderance in middle age or later age, but anybody can be affected. So if you're experiencing any shoulder-related problems, it's important to have a detailed, thorough assessment so that the correct diagnosis is made and we can give you the correct treatment plan. In terms of managing and diagnosing frozen shoulder, when you come and visit me, I will start with a detailed consultation. We'll go through history, particularly including your symptoms, how they're affecting you day to day, and also any treatments that you've tried to date. I'll then move on to a detailed examination. And with frozen shoulder itself, there's often different stages. In the initial stages, this can be a freezing phase, where you're gradually losing your range of motion, a frozen stage, which can be painful and have really marked decreased range of motion, and then finally the thawing stage, where that range of motion and pain gradually improves. In our consultation, I may perform a point-of-care ultrasound, where we're dynamically able to look at the shoulder as it's moving, and we can look in detail at the structures. Sometimes we'll do an MRI scan where we take a detailed picture of the shoulder. Once we have a firm diagnosis, we can then talk about treatment options. Now, an important aspect of managing frozen shoulder is really looking at regaining that range, which is often through physical therapy, so working closely with a physiotherapist. If your pain is limiting you being able to do those activities, we would often look at pain management. Sometimes this can be via medications, but occasionally we do need targeted injections. So this, for example, could be something like a steroid injection, which I'll perform for you under ultrasound guidance, so we know that we're treating the exact point that's required. Sometimes more advanced injections are needed. These are things like a hydrodistension, sometimes called hydrodilatation, where we would inject a higher volume of fluid, something like normal saline, which is very safe. And the idea is to open up that capsule to really help improve that range of motion for you. Now, the normal course of a frozen shoulder can often be up to about 18 months, but with effective treatment, we can dramatically reduce that period of time and symptoms, with the aim of getting you back to the activities that you really enjoy and love.